J'attends 14h05 pour commencer.
I will wait until 2:05 to start.
Bonjour, bonsoir.
Hello, good morning, good afternoon, or good evening to all of you. It's always a pleasure for me to be in a session moderated by Dr. Ginette, and I think this session is very important for us today. Dear representative of the Ministry of Health from Burkina, Côte d'Ivoire, Mali, and Niger, dear representative of USAID, Regional Office of USAID, the West Africa Office, Mr. Representative of the African Union Commission, UNFPA, dear colleagues of Mali, dear Pathfinders, ladies and gentlemen, hello. We want to welcome you in this webinar to reveal the power of community-based solutions to react efficiently to the crisis of maternal health in West Africa. If you remember, this webinar is organized during the International Mothers' holiday, which was celebrated last month. And we will agree with me that the best present that we could give to women is really a present of good health. And today, we cannot talk about women's health without talking about maternal and child health in Africa. And today, it is very important that we could take stock. And if you look at this webinar with 4 countries, and 3 of these 4 countries are affected by a crisis. And we talk about crisis. Those who are affected the most, they are women. And it is mostly women who need care. As we often say, it is not because there is a crisis that everything else will stop. It is not because there is a crisis that women don't have to go back to health centers and give birth. So what is our health center? What are our health facilities? How can we do things better to provide better services to women? I think this webinar is very important to prepare for crisis situation, but also to see what the solutions have been developed by communities and governments in order to confront such a situation when they are in a state of crisis. And this webinar is offered to present local solutions based on local data in order to reduce the number of maternal deaths. And most of them can be avoided. And we have to see how solutions developed in fragile contexts can be used and what we can learn from country to country and how we can use them in other countries. It is very important. And this webinar has as an objective, as a goal, to present these various solutions that various countries have tried to implement. It is true that Pathfinder is really involved on a world level about health and a child's health. And our goal is really to work with local communities in order to be able to prevent the, the death of so many women today in 2024. But we have to talk about how what we do with integrated approaches can help us to take care of children's health too. And for us, when mothers are in good health, it means that communities are in good health. It means that we participate in the efforts to reach the development goals, and we want to recognize the fact that our government are primarily responsible to ensure the health of local population, but governments cannot ensure maternal and child health for everybody without the help of other stakeholders. And when I talk about stakeholders, we have to involve the private sector. This is very important. We have to talk about this services provided by civil society, but also by the private sector. So we think all actors, all stakeholders, government, private sector actors, and others can help us establish durable systems to create a system that will help women to have access to high quality services. So this webinar aims also to raise awareness among all stakeholders to help us to reach the goals of the agenda of the African Union in order to reduce maternal health. We want it to be under 70 for 100,000 births in African countries, but also to have approaches that are specific concerning children's health. Today, you will be happy to see that there will be presenters that will share their experience and their knowledge and explain what has been done in those 4 countries, and we will see what works well, and we will share ideas. And after this sharing, we will see how we can implement those solutions in our own countries. And one more time, ladies and gentlemen, I would like to thank you for taking time to participate in this webinar, which is very important for women because we are celebrating mothers today. So it is very important. Your energy and your work are very important in the field. And of course, and after this words of welcome, I want to leave the floor to Dr. Ginette from Pathfinder, country director for Pathfinder in Burkina, to facilitate this session. And I hope that at the end of this webinar, we will all contribute something and we will share something. Thank you very much and enjoy the session. Thank you, Lydia. Thank you for your welcome, which is very appropriate. Hello, everybody. I hope you can hear me well, and welcome to this webinar. We just ended the celebration of the International Mother's Day, and we're talking about our mothers, our spouses, our friends, our colleagues. So women are not just statistics. Many women keep dying because of complication of pregnancy and giving birth, and the risk of death is very high when women give birth in West Africa, and we're getting closer to 2030, and we have to take stock about thinking if we are really about to meet the goals of the objective of the durable development. And dear participants, my name is Dr. Ginette. and I'm happy to be the moderator of this webinar, which is be a part of the reflection and sharing of experience of local solution, community-based solution to reduce the number of deaths of mothers, especially in some difficult context which we see in many countries in West Africa. And to lead this discussion with you, I have a diversified panel, representative of social civil society, health ministers, and representative of regional organizations. And we want to show the efforts that were made by various stakeholders to support community actions in order to reduce maternal and child health, but we'll also hope we can show other interventions that aim to strengthen the health systems, and they are really indispensable in order to reach durable results to ensure the welfare and of women. I will start with the NGOs, which contribute to the health system in order to confront the challenge of maternal death. The first panelist, Dr. Enes Yao, is my colleague of Côte d'Ivoire, who is a country director for Pathfinder in Côte d'Ivoire, and he will share some of his experience of community-based action and show some of the challenges that had to be met when working with the Ministry of Health. So, Dr. Yao, please, if you are there, I will give you the floor for your presentation. Thank you.
Merci, Dr. Ginette.
Thank you, Dr. Ginette.
Donc, à l'occasion de cette journée des mères,
during this Mother's celebration, Pathfinder will show some solutions aiming to reduce the crisis of maternal health in West Africa. There will be 4 main issues we will be developing. Next slide, please. Okay, so summary of Pathfinder International, a few statistics about maternal health in 3 West African countries, Burkina, Côte d'Ivoire, and Niger, and the intervention of Pathfinder to reduce maternal deaths in Africa, and some conclusion about what Pathfinder has been doing. Next slide. So the main fields of intervention Pathfinder are as follows. Pathfinder works a lot on maternal and child health, and also about health, family health. Next slide.
Next.
So the presence of Pathfinder in West Africa, Pathfinder has offices in 4 countries, Nigeria, Niger, Burkina Faso, and Côte d'Ivoire, and is also active in 3 other countries, Mali, Sierra Leone, and Guinea. Next slide.
Next.
Maternal health, maternal death in sub-Saharan Africa. We must say that the 2020 report from the WHO assessed the number of deaths at 287,000, and 70% of this death is about women in sub-Saharan Africa. And the reduction has been 34% in the world and 33% in sub-Saharan Africa, according to the numbers from the WHO. Next slide.
Next.
Now we're going to see statistics of maternal death in the 3 countries, Burkina, Côte d'Ivoire, and Niger, through various numbers here. For Burkina, there was 440 deaths for 100,000, and it went down to 232 maternal deaths. Côte d'Ivoire went from 598 to 385 deaths for 100,000 births. In Niger, the first numbers showed 520 deaths for 100,000, and the latest number shows 441 deaths. So the trend is really going down in these three countries. Next slide.
The main causes are hemorrhages, especially during postpartum, infections due to postpartum, hypertension during pregnancy, preeclampsia, eclampsia, but also complications after birth. So here's what Pathfinder has been working on with different governments to reduce maternal death. Next slide.
Donc, l'action de Pathfinder a tourné aussi
So the Pathfinder action revolves around the different pillars. So to reduce the 4 too many pregnancies, Pathfinder is working with the government to provide access to modern contraception, to make it free in Côte d'Ivoire or Burkina Faso, within community in 3 countries, and also the better services, better quality of services of family planning in those countries. Next slide, please. The capacity building for teenagers and youth to delay first pregnancies. So through this initiative, we involved young champions to create demand with their peers in those 3 countries. There's also the initiative Reaching Married Adolescents in Niger, and capacity building of youth and adolescents in school. Next slide. The third one is the reduction of negative social norms. So, for example, the transformational gender strategy, the Club of Community Health, and the Community Card of Performance that was implemented in Burkina Faso and in Niger, the Caravan of Religious Leaders to enable an environment, to create a favorable environment to use family planning and contraception. Next slide. When it comes to obstetric care and the reduction of first and second delay, so training of service provider to prepare pregnant women for their delivery, and also to have access to obstetric services. There's also the delegation of tasks to traditional midwives so that they would take care of women in very challenging and security challenge area. Next slide, please. For the third delay, Pathfinder has implemented the implementation of domestic resources to provide better services through community tasks at the district level, which are composed of religious leaders, but also economic operators. Next slide, please.
Sur les causes directes des décès
Now
maternels,
let's talk
il y
about the
a le
direct
renforcement des
causes of
capacités
maternal
des
death.
maternités
We
qui
want
les pratiquent
to
à haut
build
impact
capacities
pour prendre en charge les hémorragies du postpartum et
to
l'asphyxie du
take
nouveau-né.
care
Il y a des
of
équipements,
direct
des établissements
postpartum
CP et aussi
hemorrhages
la participation des Pathfinder à la surveillance
and the
des
breathing
décès
capacity for
maternels
the
et précoces
newborn, which are
dans
the
chaque
main
territoire
causes of
pays.
this
Diapo.
of death. Next slide, please.
Le constat.
What have we noticed?
Les interventions de Pathfinder
The Pathfinder
sont
interventions
adaptées au contexte de
align
chaque
and
pays,
are adapted to
mais
the context of
généralement
each
alignées
country,
sur les priorités
and they are
de ces
aligned
pays.
to the priorities of
Et
this
un
country.
constat majeur, c'est que les interventions sont
But
généralement
very often these
fragmentées,
interventions are
parcellaires
fragmented,
et
they're
n'embrassent pas
insular,
à la
and
fois
they do
les
not
déterminants ou les
cover
déterminants
all the determining
qui sont
factors at the same
facteurs
time.
de décès maternel. Il est rare d'obtenir
And it
des
is rare
projets,
to have
des interventions qui
to work on
embrassent
a
à la fois
project which will
les
cover
retards, les 3
the
retards, les 4
delays,
trop,
the four
et
too
qui impliquent
many, and that
davantage la
involve
communauté et qui agit
all the
aussi
community,
sur les 4 retards, généralement le 3e retard. Diapo.
especially on the third delay. Next slide, please.
Diapo. Bien. En conclusion, notons qu'il y a
So
une
as a
baisse
conclusion, there's an observed
du niveau de
decrease
mortalité
of the
dans
level
les 3
of
pays de la
maternal
sous-région
death
ouest africaine.
in the countries of the
Cependant, beaucoup
sub-region.
d'efforts sont à faire
However,
dans l'optique d'atteindre
much
les
effort is
ODD
needed
2020
to reach
à
the
savoir passer
the 2030
10 décès maternels
ODGs
pour
to
100 000
get
naissances
to
vivantes.
get to
Pour y
the
parvenir, les
to get
pays
below
ses
the
partenaires
70
devront investir davantage dans des
maternal
capacités
death
logistiques et
for
systémiques qui
100,000
abordent à la fois les
births.
déterminants
And to do
proximaux et
so, the
lointains
countries and
et
partners
aussi
will
sur les
have to
causes
invest
directes
in
de
holistic
ces mortalités
inventions
maternelles en
and
impliquant les
that
communautés
focus on the four too
elles-mêmes
many, the
et
three
aussi en
delays,
adoptant
but
des lois
also that
étatiques
work
favorables
very
à l'utilisation
closely
des
with
services
local
en santé et à la
communities.
reproduction. Voilà, partager un peu ce que
So
Pathfinder
I've just
a
shared what
apporté aux côtés
Pathfinder
des
has
différents
brought
gouvernements des 3 pays pour
with the governments of those
adresser les questions
countries
de la
to
mortalité
address
maternelle.
maternal
Je
death.
vous remercie.
Thank you very much for your attention.
Merci beaucoup, Dr. Yao.
Thank you so much, Dr. Yao.
Notez votre appel à des
I
financements holistiques.
I heard your call for domestic finance, and we are reaching out to donors that could work with us and that would promote an integrated approach. Thank you so much for those elements, which are very relevant. Now we're going to reach out to Dr. Lamy. He is the director, Lamine Fanto Sogoba, and in Mali. He will do the same as Dr. Yao, but with a focus on Mali. If you are online, Dr. Sogoba, you have the floor. Thank you so much, Dr. Ginette. Hello, everybody. My name is Dr. Sogoba Lamy. I'm program director in Mali Health. And our mission is to improve neonatal and the mother and maternal death through reproductive programs. We work with health centers and strengthen capacities and involved communities in our projects. We want a better world in which the health system meets the demands of the population and where maternal deaths are inevitable are completely eliminated. The quality and capacity building and the respect of partnerships are part of our values. Our strategy focuses also on action for health, local financing, improving the quality of our services, and of course, advocacy. It is my pleasure to share some of my slides with you to propose some solutions. So here's the agenda. We are going to talk about the context, the new path to follow, some solution targeting communities centered around women, and some examples. Next slide, please. So the adoption of the health politics in Mali in 1990 and its implementation based on a strategy on primary care started with the Bamako initiative. It contributed significantly to making better the state of the health of its population. Of course, there were some significant efforts. For example, if we look at the numbers here on the side, that the maternal health, 325 for 100,000 live birth. Next slide. In Mali, so the ministry gave a great position or a great role to community to be involved in its politics and its process. So they enable community participation, which has become the foundation of its community health system in Mali.
Slide.
Next slide, please.
Alors, pour aller vers une nouvelle voie sûre, il est clair que le moyen de
towards a new path, it is very clear that to end maternal health, and the inevitable one, we need to improve the quality of healthcare, and the current approaches do not always resolve our ongoing problems. So to do so, and to meet this challenge, we need to work with communities. There's the community leadership and the active participation of women to improve the access and the quality of health services. Next slide, please. When it comes to solutions targeting community and centered on women, so here's the current approach. We have national financial centered around the states, and we depend on donors. So the approach is based on service provision, which is proactive, but we want an equitable and fair approach with the support and resources, with more respect for a decentralized system and of its actors, but also different mechanisms of financing at the community level that will be more equitable, but also targeting the people and the women that need the most help. Next slide. So here are some examples. We work with community health workers because we want to improve knowledge and when it comes to maternal and neonatal health. So for example, the visits before and after delivery, but also with contraception use. So in 10 years, in the last 10 years, with the communities that are part of this program, we have recorded no maternal health. However, making it durable is very challenging. Next slide. When it comes to financing health for women and community, this is an approach that is already used, but it needs to be better. So we regroup women in groups of 15 to 20. And the services are targeted to their needs.
Et au cours de l'année 2023,
in 2023,
dans la caisse santé plus de 19 millions de francs CFA et ont pu également aussi assurer la
they
prise en charge
received
325 cas alors de maladies.
they receive funds and they address
Pour ce qui
different
concerne
diseases.
l'amélioration participative, alors,
When it comes to
de la qualité de
participation,
soins, c'est un modèle qui est presque unique pour Mali Health.
it is a very
Avec la
unique model
participation
to
communautaire,
Mali
comme
and
dans
involves the
la
community
proposition de
as well.
l'amélioration de la qualité au niveau de ces centres
We
de santé
create
communautaires où nous
different
accompagnons
teams at the
pour,
community
par
level
force des représentants du personnel technique et des membres
with
de la santé
representative at the technical level
Il y a aussi les représentants alors de ces communautés des usagers, donc aux femmes qui
and
prennent
also
part
representative
à
of
ces réunions
users. So they represent the women
alors les besoins en fait de
and they
ces
very
femmes lors de
clearly
ces réunions
express
permettent
their
de
needs
contribuer
during these
également à la
meetings
résolution des problèmes relatifs à ces
and
femmes.
they help
Et aussi à la
focus
satisfaction
on
de ces femmes plus de 40
issues,
CSCOM que nous
focus
accompagnons.
on the satisfaction
Alors,
of the women that attend
et
these meetings.
Ali, slide,
Next slide.
apparemment ça n'a pas changé. Voilà, merci bien.
Thank you.
Voilà, donc il y a aussi la satisfaction alors des femmes
So
qui
we're
fréquentent
talking about the
les
satisfaction of
CSCOM
users.
que nous accompagnons. Donc, elles peuvent donner leur feedback alors
They can
sur
provide their
les
feedback
prestations donc,
about the services that they
de ces agents de
receive,
santé qui se trouvent au niveau des CSCOM et également aussi expriment aussi leurs besoins. Et les
but
boîtes de
also
suggestions
express
également
their
qui sont
needs. And there's
au
also
niveau de
a
ces structures-là
suggestion
également
box
qui
at the
permettent
level of the
pouvoir,
structure,
donc, de pouvoir donner
which
leur
gives
avis
them
donc,
the
sur les
power
initiatives
to
qui sont
provide
menées alors,
their
au niveau de la
feedback
santé publique et
and
également aussi
express their
à
needs.
manifester alors leurs besoins. Donc, et les restitutions sont faites à l'endroit et des membres de la SACO
And
et
that's
également aussi
happening
les
at the
prestataires
level
que
of
ces
the
besoins sont
service.
pris en compte. Et comme l'association de santé communautaire, c'est elle qui est l'organe de gestion, nous les accompagnons également aussi en
Since it's working at the community level, we send out surveys and evaluations to understand their needs and their satisfaction. Next slide, please.
OK. Donc, sur ces quelques mots, je vous
So
remercie
with
pour
these
votre
words,
aimable
I thank you very much for your attention.
Merci beaucoup, Dr. Sogoba.
Thank you so much, Dr. Sogoba. I noted several points, but I think what stood out is the financing of health at the community level through these different schemes, through the AGRCS, which basically would finance health services for women. This is a great and innovative approach. Thank you so much. Now, we are going to provide a regional perspective. This is going to be Delphine Alleluia. I think I pronounced her name correctly. Director at the regional level, which is focusing on the restraint of the accelerated reduction of maternal mortality in Africa.
There is a meeting happening currently in
Merci beaucoup, Madame la modératrice.
Thank you so much.
Bonjour, bon après-midi.
Good morning, good afternoon.
Plus généralement, sous l'appellation CARRMA+. Vous pouvez y aller maintenant, Madame Delphine.
Please go ahead, please.
Est-ce que vous pouvez m'entendre?
Can you hear me? Can you hear me correctly? Yes, we can hear you just fine. Thank you so much.
Excusez-moi, c'est juste
So-
des salutations en français, mais
So just greetings
je
in
vais faire ma
French,
présentation
but
en anglais,
I'm going to present this in
Merci.
English to represent the director. Thank you so
Good
much.
afternoon and good morning, depending on where you are. My name is Alleluia Delphine. I represent the African Union Commission, Health, Humanitarian Affairs, and Social Development Department. We wanted to share through this webinar on the campaign, on the African Union campaign also, which was strengthened to reduce maternal mortality in Africa. The theme for this year is the Africa Cares Better Reproductive Health for Women, Children, and Adolescents. Next. But before I speak a lot to this campaign and more about the campaign, I wish to start with this video that summarizes the campaign in general. Next page, please. Next. Next. Next page. I can see there is some technical issues, and I trust this presentation was not the one I was supposed to do, but let me just proceed in terms of time to save on time. The campaign started in 2009, and it was CARRMA. It was only CARRMA without the plus, under the theme Africa Cares, No Man Should Die While Giving Life. And in 10 years, it was evaluated, which was 2019, where we received many inputs from different consultative meetings with the regional economic communities, partners, and they provided a new direction to make it a little bit broader. And under the theme now, I mentioned earlier, Africa Cares Better Reproductive Health for Women, Children, and Adolescents by 2030. Next. The objective of this campaign first is to broaden and strengthen accountability and partnership for RAMCA, reproductive, maternal, newborn, child, and adolescent health. Second, to strengthen leadership and governance for RAMCA policies and quality services. Improve social reproductive health outcomes for adolescents through increased access to information and services, while also we look forward to strengthen knowledge management and learning system. Next, please. This is not disconnected from the previous slide because it's showing that the objectives and the focus of CARRMA is RAMCA, and we also look forward to soliciting stakeholder goodwill by increasing commitment, political commitment, and mobilizing domestic resources in support of the RAMCA outcomes on the continent. Generating and providing data on maternal, newborn, child health, and accelerating action to reduce maternal and infant mortality in Africa or on the continent. Next, please. This is the slide that mainly speak more of today's webinar theme and the Women's Day in general. The African Union, we have the role to coordinate the implementation of this campaign, but we don't do this alone because we trust that partners and different stakeholders are keen in implementing those strategies, and they are there for us, given that the union itself, it's not mandated to implement, rather to advocate, do high-level advocacy, while also putting policies and guidelines to guide member states in improving the health outcomes on the continent. We update on the CARRMA Plus digital platform, have websites and some social media handles. While we also present on evidences for actions at a higher level organs of the African Union, including the Specialized Technical Committee on Health, Population, Health, Nutrition, Population, and Drug Control. We mobilize funds at the AUC level to enable the secretariat of this campaign to function, while also improving its accountability. Coming back that the main, this is mainly in the region of the ECOWAS, I want to emphasize on the role of the regional economic communities in support of the improvement of maternal outcomes in general, but also to this campaign. Regional economic communities support the implementation of the campaign activities in general, but they also perform follow-up visits to member states to support monitoring the commitments of their heads of states around maternal health outcomes. They coordinate the nomination for the biennial Mama Africa Award, collaborate with the Commission to engage parliamentarians and other politicians in promoting the campaign's agenda, while also they ensure the integration and institutionalization of the CARRMA Plus objectives that I presented previously within national framework of their member states and strategies, as well as the universal health coverage agenda in general. Channel information about the campaign by leveraging on existing platform. So there's no need to change what is already there. They have to just input to their existing platforms. They help us or support us mainly in sharing experiences and good practices as well. Let me come to multinational and development partners, civil society and private sector, including Pathfinder, who is also one of our key partners into this campaign. Their role is to support the implementation of the objectives and the activities of the campaign, definitely. Provide technical assistance and capacity building to the AUC, regional economic communities and the member states, while facilitating their implementation of multi-sectoral strategies for improved RAMCA outcomes. And I want to highlight this because Pathfinder is doing the same in different member states of the Union. And this is where our partner, some goes directly to the implementations and that contributes to the outcomes of RAMCA. They support also the Mama Africa Award and provide technical and financial support directly to member states, as I mentioned. Next. Differently, in summary of the previous slides, is that there are many ways of collaborating on RAMCA outcomes, but through this campaign, especially collaborating with the African Union and even helping in improving the maternal health outcomes in the member states through different channels. So I won't go deep. You have seen that there's supply chain advocacy, leadership, community engagement, and empowerment. This is something that brought us together today. And you see that it's an area we look forward to see many exchanges, many sharings of experience on where different partners, including Pathfinder, are working on. Next, please. For this year, we had planned to have some different task force together to discuss different issues so that the union can push forward at the higher level of its mandate. And we had also planned to have a regional launches, where we look forward to have ECOWAS also launching the campaign, maybe in the upcoming, the quota or in the next year. We are planning to have a community of practice. I want to highlight here this because this is where we will see more of the experience from the community, from our community, and from different partners working with the communities, where will be sharing with us some case studies, some good wills, or some even good practices to be shared among partners. And we look forward to have some high-level events around also maternal health. Next. Different channels we use some global days, as you know, and some meetings, and such as this one that gathers us today. And there's Immunization Week, Day of African Child, African Women's Day, Breastfeeding Week. All those are the channels and advocacy events we use to amplify the key messages of this campaign at a higher level. Next. I won't go deep into this because you will have to visit to the next page, please. Yes, if you have any recommendation, I would wish to scan this code and then you share with us what you think about the campaign, how we can improve, and how also we can work with you. The next is to also request to follow our page, next page, while I thank you for your attention.
Merci beaucoup, Madame Alléluia Delphine. qui parlait, je le souligne
Thank
au
you,
nom
Dr. Alia Delphine, who was talking in the name of the head of humanitarian affairs of the African Union Commission. Thank you very much. So after the regional perspective and those of the civil society, I think that one of the most important stakeholders about what we are talking about now, it is the Ministry of Health. Whether we talk about strategic orientation, the operational implementation, financing, coordination, the Ministries of Health must be at the heart of what we are doing to make sure that everybody plays their part. And whether we are donors, NGOs or others, it is important that the Ministry of Health defines a framework of action for all those stakeholders to prevent duplication of efforts and wasting of resources. We are lucky to have 4 representatives of health ministries, and they will talk to us about the strategic efforts undertaken by each of their government in order to reduce maternal health. And even though there is a lot to be said, we are going to talk mostly about strategic orientation that promote the development of community actions, and they will also talk about some of the challenges they met. And I will start with Burkina Faso, because I'm happy to be the moderator for Burkina Faso, to Dr. Valérie Zombe. She is in charge of community health and public hygiene in Burkina. Dr. Zombre, you have the floor. Thank you very much for giving me the floor. It is a pleasure for me to talk to you this evening to share the experience of Burkina Faso concerning the reduction of maternal health, death, the number of deaths. And we'll talk about the context of my country. We have a dual burden because of insecurity, and this led to the closure of a number of institutions and facilities, or a reduction of their operation. And there are fewer health professionals available now in many places. And that's why we have to use a model based on the fact that we have to know what is happening, what are the facts in the field in order to make decisions appropriate. And we also to make sure there is enough ways for transportation of products and people. And we have to make sure that services are maintained in spite of the security problems. And so we developed strategies in Burkina in order to ensure continuity of services. So to talk about the question about what has been done to reduce the number of maternal deaths in Burkina Faso, I must say that we have had to prepare a number of documents and find ways to coordinate the work of the various stakeholders and actors. And as you know, in my country, promoting health is one of the priorities of our government, and community health is very important in this way in order to provide health coverage. And we have developed a number of documents, a national strategy for community health. And we also developed a new national strategy for the 2024-2028 period. And this is based on the goals of community health, and it indicates all the actions and all the goals to reach our objective. And this strategy has been developed along with the development of a plan for the communication of health, community health issues in order to coordinate work among various actors. We also read again our Code of Public Health in order to make sure it is appropriate and make sure that tasks are delegated on a community level to make sure that these services work most efficiently. We also revised our protocol to make sure that there will be a reduction of the number of postpartum deaths and hemorrhages, and we want to be sure that everybody knows what has to be done. And we also worked on delegating tasks and making sure that the right people are present to do what has to be done. And we want to be sure that the results that we are targeting are reached. And beyond these documents concerning community health, we also developed other documents, and I will mention them quickly. Another strategic plan with a folder about investments in order to mobilize resources in a most optimal way in order to strengthen healthcare. And right now we are developing a plan, an integrated plan to improve mothers' health and survival of children. We also have prepared guidelines to help health agents to manage what happened after an abortion, for instance, or if there's a problem during pregnancy. And we have guidelines that help us to control what happened and assess what happened in case of death of a mother. And there are agents who are charged now to do some studies and prepare surveys to explain what happened and what should have been done, or what could be avoided in the future. And we also have adopted a policy, a strategy to reduce the number of maternal deaths. We strengthen the capabilities of training to make sure that agents be available and have the knowledge required both on a community level and also at the level of health activities in health facilities. And so we have to make sure we have enough trained agents. We also strengthened the offer of services by helping community health agents, and we trained community health agents. We give them what they needed to be able to provide services in family planning and different products that they would need. And we have also ensured the delegation of tasks on the community level, and we trained and equipped people who who help women at birth to make sure that there won't be any excessive blood loss, and make sure that women survive when they give birth. And we give classes to those women who help with birth, and they are now doing good job, much better than before. And we are proud of this improvement. And we also have helped the community health agents. We started about 8 years ago, and there's a budget of the government, of the state, to provide training and provide equipment and products that they need. And in 2023, we thought it was necessary to recruit 15,000 community-based health agents in order to strengthen our work in some areas that are, well, there's a problem with security, and we want to be sure that the population could have access to health services which were lacking in many places. So these community health agents were recruited for that purpose. Yeah. So sorry to interrupt, but let's have a few minutes. So we have developed schools to teach these skills and they provide information. So we have really taken measures that improve the work of the health agent, and we make sure that there will be free care for women. What are the difficulties we are being confronted with? The problem is that there are also bad practices and inappropriate practices that we have to remedy and we have to improve. And we have to make sure that there are enough agents and enough trained agents. And we have to make sure that these agents are able to work efficiently with the patient in all areas, and we mobilize resources in order to ensure that there is continuity of these services. We have to be sure that these health agents are motivated, and also we have to make sure there is a follow-up of the work of these health agents. So this was in a few words what we are doing right now in order to ensure the continuity of services in a community level through our community-based health agent. Thank you very much.
Thank you so much. This is not much of a summary. You said everything. I really appreciate it. And I also noted the great effort to get to this very, very high level when it comes to task delegation. It's very often, especially at the community level, it's challenging. So thank you for all your efforts that are focused on health and in community. Now let's move on to Niger. Now we're going to invite the General Director of Reproduction, who works at the ministry level. I hope Dr. Hassou Issoufa, will give us some perspective so that we can gain a little bit of time. Thank you so much, Dr. Ginette. Thank you to all of you. I'm thrilled to be with you today in this panel. We're going to talk about maternal death. In our country, it has a very high level of maternal death, higher than the global average. And when it comes to neonatal death, it's also very elevated. The numbers are very high. So, therefore, it is really important for us to participate in this panel. And it's really about meeting the population where it's at right now. So what do we do to meet this challenge? And Niger has started strategic solution starting with the Maputo initiative and with the CDC meeting that gathered all countries. So we implemented our own strategic plan And we also implemented a health state plan, but what is expected is obviously the decrease in those numbers. So Niger is fully aware of these issues, and that's why since 2005, there was a law so that this section, which involves a lot of complications and death. So this decree and also the state provided free neonatal services. But that's not all. We deployed also strategic documents that you already know, 2021, 2025, which will contribute to the reduction of maternal death, which will reduce these numbers. This also applies to neonatal health, but our global plan comes with a scorecard and indicators that will allow us to check the numbers at the regional and state level.
C'est dans cette même optique qu'il faut le dire, il y a un certain nombre de directions qui ont été créées pour accompagner tous ces...
These aspects
comme la direction de la planification familiale elle-même,
came with those decrees,
de la santé communautaire,
such as the implementation of community health, but also digital health.
Nous sommes un pays où la couverture sanitaire est assez faible.
So our health coverage is fairly low in our country, meaning that 1 out of 2 Nigerians is far from any health center. So we need to promote both community health and digital health. And focus on both aspects very strongly. And let's keep in mind that lots of those deaths are related to the fact that those births are happening outside of health centers, and the state of road is really bad, so it prevents a good access. So we also deployed different documents to accompany this process. But now let's talk about the financial aspect. When it comes to health, the health expenses are that of the budget of families. It's entirely too high. So if you get sick, it's going to eat up the budget of the household. So we adopted another strategy at the national level to tackle this issue and enable all women to have access to health services, quality health services. So from a strategic perspective, we institutionalized the surveillance and response to maternal death. This was implemented in 2016 And we implemented also the perinatal aspect of it
Avec tous les différents comités qu'il y a depuis le niveau national jusqu'au
through
niveau
different
départemental
committees
et communal, justement pour prendre en charge tous ces maternelles.
to
Et il faut
tackle
dire
this issue.
également, nous avons cherché les centimes additionnels au niveau communautaire, puisque
We added a community level to this.
coûte très cher au niveau de nos populations qui sont éloignées des
All
formations
these,
sanitaires. Donc,
all
un
these,
système qui permet
all the system is
centimes
very
additionnels
costly,
juste
especially when
pour
remote
ajouter
for the
aux
populations
parcelles
that live
pour
away
ceux
from health
qui payent, bien
centers.
sûr. Donc les adultes, qui permet d'avoir quand même un certain budget qui va
So
faciliter les évacuations
we
sanitaires
help
et
them
donc
through
réduire le deuxième retard dont on
a
Et donc,
to implement different centers.
Un peu plus vite, s'il vous plaît.
Can you please
et
go
donc,
slightly
voilà,
faster?
de façon globale, un certain nombre de documents stratégiques.
So
Et
those are
c'est
some of our
aussi, bien sûr, dans le cadre
strategies.
de développer dans le cadre des soins
We're also
conjugaux et voies
developing
naturelles,
other measures in
un réseau
obstetric
SONU qui est là pour
healthcare.
assurer justement
We work within a network of
des équipements en
physicians.
infrastructure, bien sûr, de
We
santé,
invest
pour
in
que
infrastructure and
soit de
equipment
qualité. Nous avons
to provide
également, dans
quality
le cadre de
services.
la prise en charge de ces questions donc de santé et de la femme, de réhabilitation et de construction des hôpitaux de district.
So we enable the construction of hospitals or health centers to decentralize the care in the deserted areas.
C'est comme ça également, parce que nous avons cette substance précieuse, les usines de production d'oxygène au niveau de ces hôpitaux pour garantir la disponibilité de l'oxygène.
And we want to make available oxygen for those hospitals.
Oui,
M'entendez?
oui, je
I
voulais
can hear you.
terminer.
I would like
Que nous sommes
to
dans les perspectives
finish
d'organiser
by
un
saying
forum
that
national
we're thinking about organizing a national forum with all the different involved players. And because we want to create a national observatory, and we're currently thinking on how to build capacities so that we can have access to different areas. But what is really challenging right now is the national coverage. There's a lack of motivation.
Ne tombe pas régulièrement et bien évidemment l'insécurité qui
And
est
of
là,
course,
qui perturbe un peu les systèmes.
and the safety issues are really challenging for the implementation of this system.
Voilà un peu ce que je vais dire.
So
Je pense qu'au niveau de notre forum, nous allons
this is more or less a summary
surtout au niveau
of our country, of the situation in our country, but we want to focus on the community level, on the digital level, to reach our goals. I thank you so much for your attention.
Merci beaucoup, docteur.
Thank you so much,
Je sais qu'il y a
Doctor.
pas mal de choses à dire.
I know there's a lot to be said.
Je retiens un peu,
So
un point essentiel qui a attiré mon
a few
attention,
notes
la
on
direction de la santé numérique, si je ne me
on
trompe
the
pas.
creation of
C'est pas commun.
digital health. That is
Donc,
not a
on
common
va
initiative.
peut-être apporter un
And
plus.
it's something that
Il y a la question du
really
statut
could
de
bring
la motivation des
could
agents
bring
de santé
something
en
else. There's
communauté qui a
also the motivation and the work of community health workers.
et qui ressort également dans votre
And this
présentation.
is happening in your country and other countries. Thank you so much. And maybe during the Q&A, we'll come back to this issue. Let's now focus to Mali with Pierre Kamate, who is in charge of reproductive planning and health at the regional level in Bamako. He is going to do the same thing and present the situation in his country. Pierre, if you're around, I count on you to catch up on our delay. Thank you so much.
Bonsoir à tous.
Good morning, good afternoon, good evening, everyone. It is my honor to share the situation in Mali, especially around the Bamako district. So my country is facing an awful situation of neonatal and maternal health. Since 2018, it shows a ratio of 325 for 100,000 for maternal health and 33 for 1,000 live birth, and a mortality rate, a death rate of 101 for 1,000. So very, very high numbers. However, our community health centers are present and implemented an emergency plan. Also, the coverage of C-sections, free. And also the institutionalization thanks to a decree in 2017, but also the surveillance of maternal death, the implementation of 2024 plan, the installation of different surgery centers in case of emergency, access to contraception, deployment of cancer, cervical cancer, the creation of a national office for reproduction, but also a decree for the creation of those initiatives. Many other initiatives, of course, such the opening of a medical school and another hospital for perinatal health. We had to strengthen and build capacities to promote qualified healthcare workers, but also bring pediatricians, OBGYNs, and midwives. We built capacities also in different areas to disseminate information, to train and involve the youth, share information about oxygen therapy. We provided equipment when it comes to oxygen therapy. We renovated some centers. All our structures were equipped with an ambulance and CPR. We worked with different technical partners in all our structures. We've provided suggestion box and surveys, all of this to make those services, those health services better. However, we're facing a certain amount of challenges, including hard access to those health centers, the lack of, the significant issues when it comes to pregnancy and delivery, the lack of education of women and their partners, the lack of coverage when it comes to socio-health coverage, inadequate infrastructures to the current needs, the lack of human resources to meet the demand, socio-cultural practices that are negative and go against these issues. But to sort of to counteract these issues, we have implemented emergency units in our health centers. We also want to organize a multi-actor forum to disseminate information on inevitable death. We want to reinforce our capacities at the district level. We want to audit death and survey training, but also implement technical education at all levels. But to thank all partners on the technical and financial side in Mali. So Mali Health has done incredible work in those interventional areas in 2023 because in all those areas, there were no maternal death. So congratulations and thank you so much. Thank you so much, Dr. Kemate. I think I noted one element which was key here, especially the implementation of advanced medical posts, areas or centers. I think this is such an innovative approach in remote areas. Thank you so much.
Alors, mon dernier panéliste, nous provenant d'un ministère de la Santé, mais pas des moindres, c'est Dr.
The last panelist is Dr. Seydou Kone, in charge of studies of health of mothers and children and family planning in Côte d'Ivoire. And he would have 5 minutes also to talk about community solutions on a strategic level to reduce mortality of mothers and children. Thank you. You have the floor.
Dr. Kone est là.
Dr. Kone? Having sound issue. Interpreter apologizes, but the sound is terrible. We have trouble hearing you. Can you hear me? Can you hear me?
Est-ce que vous m'entendez, moi?
Can you hear me?
Un peu mieux. Allez-y, on va
It's a
voir.
little better now. Go ahead.
Ah,
Oh, I'm in Abidjan. Thank you for giving me the opportunity to talk about Côte d'Ivoire's policy. And Dr. Kone, unfortunately, will not be able to talk, but regarding what we just discussed, based on the indicators of a high level of mortality, the Ministry of Health of Côte d'Ivoire, along with his partners, have been working very hard, and I want to thank all these partners, especially international partners. So thank you to help the effort of the Ministry of Health to reduce the rate of maternal mortality. We are going to talk about activities that enable better access to health services in various parts of the country. And it is important to show how we manage to improve quality. I'm sorry, to improve the quality of services for mothers and children. Côte d'Ivoire has made effort to improve population health and also facilitate access to health services for the population. Before 2019, there was a gap between the administrative administrative sector and the health sectors, and there were different regions. And there was some problems, and there was some confusion, and we couldn't really follow up and see what was happening. But we now have decided to align the administrative and health divisions of the sectors, and now we are much more efficient. Regarding financial access, the government of Côte d'Ivoire institutionalized targeted gratuity for children and mothers. It started in 2012 about prenatal consultations, delivery, C-sections, and all possible obstetrical and neonatal complications that may follow. On a financial level, in 2014, the government adopted a law to guarantee equitable access to health services for the entire population. In 2021, the government decided to put in place free care for teenagers also to have access to medical health. Regarding family planning, it is good to have financial support, but we also have to implement it and make sure that there is access to the services. So starting in 2020, the government started restructuring the system and build new facilities, and 3 out of 4 new geographic centers have been renovated, and there are now many more facilities that are being built or have been built and put at the disposal of the population. So in order to guarantee access to those services, the government organized the delegation systems for contraceptive work, and also the government organized a new system enabling primary care physicians to provide obstetrical services if needed, if there's no other access to obstetricians or gynecologists. In addition to these structures, the government also appealed to many retired anesthesiologists and other doctors, specialists, and try to convince them to go back to work and work in these new centers and new facilities that had just been opened. Still, you have 2 minutes left. I need more than 2 minutes. But regarding the development of new standards and norms, the government has updated documents in order to make sure the services are updated and improved everywhere to improve the health of mothers and children. And the government and make sure that there's more availability for this kind of services. Just have to summarize, of course, the main intervention of the government, but there are some issues, for instance, making sure that there are enough drugs available, and the new system does not cover all the services that are needed to give to mothers and children. And the free care gratuity system that was adopted in 2021 has not been implemented entirely on a national level. And so we have a network that makes sure that we provide access to services in isolated areas by improving means of communications that enable health facilities to talk to other health facilities about specific issues with specific patients, for instance, to make sure that they're all taken care of. And so they have to have more ambulances available. So in a few words, this is what the government of Côte d'Ivoire has done during the last few years to target this objective about sustainable development goals. So thank you again for the organizers of this panel. Thank you. Thank you very much, Dr. Connell. Then the Ministries of Health we're going to have, in addition to the opinions of the representatives of the ministries, they're going to talk about the specialist in family planning in Niger, and he will talk to us about his main experiences about financing and funding, and will make recommendation about what to do next connected to the goal of reduction of mother and child death. Dr. Manzo, if you could speak in just 5 minutes so as we can have time for questions and answers afterwards. Thank you very much, and hello everybody. So I will talk fast, and I work with a United Nations Population Fund, and we work in close collaboration with the government. And we also try to apply a strategic plan to try to make sure that all the needs in family planning are met, and we want to eliminate violence against women and also the number of deaths of women during pregnancy. And also the government has developed community-based strategies to contribute to the reduction of maternal death. I will start talking about the strategic partnership we developed with religious and traditional leaders who are in close contact with the population and in the field in order to help to improve maternal health and also the reduction of the number of mothers' deaths through the use of health services. And we also strengthen the capabilities and powers of the traditional chiefs and developed community initiatives in terms of funding, for instance, and also referrals. And some measures were taken in different places. For instance, by make sure that all their contact with various families who have in needs of such services, and so the access is provided to health facilities for these families. And we also developed coordination with the traditional and religious leaders in order to raise awareness so that they could educate the population. And we have provided training to some of these leaders to enable women and children to use existing health facilities. We also help the government to organize a campaign in 2 regions per year to promote the campaign in order to develop family planning and also the health with the pregnancy and deliveries, and also fighting against children's marriage. So it's we have involved many traditional and religious leaders in order to raise awareness about the problems, existing problems, and make sure we can improve the situation in order to reduce maternal death. We also strengthened community initiatives to targeting teenagers, like for instance, girls who go to school or stop going to school, and we are trying to identify them and in order to give them advice and answer their needs, to tell them what is available. And we have improved the skills of health agents, our community health agents, to help them if need be in order to reduce maternal death. We also try to put everything to scale by, for instance, delegating tasks and have a system of what you call self-administration to strengthen the health systems, the health agents, in order to help women have better access to health services, and we make sure that the people who live in remote areas can have access to health centers. And we want to go to the last mile. As a recommendation, we recommend 2 or 3 things to strengthen those partnerships that I mentioned with religious and traditional leaders, which is very important because we won't be able to reduce maternal death without concrete actions on a community level. There's also the issue of the statements and accounting for all mothers' death, because we don't know all the numbers. We don't know exactly how many mothers died while giving birth or during pregnancy. So we have to have good numbers to show exactly what's happening in the field. And there is also another issue. We talk about putting to scale task delegation, and the government developed a document to help in this field so that the community health agent can offer many services that they were not allowed to offer until recently. This is one of the recommendations. We also try to better organize the human resources in health, and it was important to make sure that we don't waste the time of those people. Thank you very much. So we do not have much time left, but I will try to see which questions were asked, and I will select some of the questions in order that some of the panelists may answer. I see a question. Dr. Zombre, I will ask you. There's a question about the crisis in Burkina that says, because of the lack of security in some areas in Burkina, what initiatives are being taken in order to help internally displaced people, especially regarding maternal death? Dr. Sombre, can you say a few words about this? Thank you for this question and for the interest in this. So initiatives were taken in order to help internally displaced people in order to reduce mothers' mortality. We have created a system to allow some actors to act urgently and to enable them to provide services even in isolated areas. And we have mobile clinics that we have created which we use to be able to reach displaced population and provide them with services. And we also work with NGOs to help us reach those people who live in isolated areas which are deprived of health services. And in addition, we have intervention on the community level through community health agents in order to offer services to those displaced population. So we have several strategies that we have put in place in order to reach internally displaced population so that they could benefit from health services of high quality. And we also have put in place a system and enabling us to distribute drugs and medicines all the way to the last mile. And it's very important. And we are providing this assistance with the help of NGOs and other stakeholders in order to make sure that those medicines are provided to all the patients who need them wherever they are located in the country. We want to be sure that essential quality services could be available. This is what we have done to respond to this question. Thank you very much. I hope you heard me. Yes, very well. Thank you. Yeah, I know that in the current context, you have to adapt to changes because things change so fast that you have to change things all the time and adjust. So thank you very much. I saw a second question for Dr. Pierre Kamate from Mali. We would like to have an explanation about what you do about when surgery is needed. Can you say a few words about what you said earlier? Thank you very much for the interest you showed about advanced surgery. We called it PACO. It started in a health district when I worked as a young doctor. And we had a community health center that was close to the border with Côte d'Ivoire. And it was when it was the rainy season, and sometimes the ambulance would take 5 hours to reach those villages to go and 5 hours to come back to the health center. So you see how what the problem was. That's why we have decided to try to create advanced surgery facilities and develop mobile clinics to make sure that there are agents able to provide C-section services.
Thank you very much. It makes sense also for Burkina Faso because we have those advanced surgery posts which applies to displaced people. We unfortunately do not have much time left. So what we're going to do and what I suggest is that we collect all questions, and at the end of the webinar, we can answer to all the different participants. I'm just going to summarize what we heard today during this webinar. As the webinar went on, I was trying to summarize what was happening. So I noted the following. First off, it's very important to have a holistic financing to meet some of our challenges, but also propose an integrated approach to meet or to respond to this deficit. I also noted a great experience. I think it was in Mali, the SGF coverage, also the delegation of tasks at the Burkina level, which was very important because it went a little beyond to what we usually do, enabling some of our healthcare workers to keep promoting and keep helping people on site, and also the security crisis was help push this agenda and the delegation of tasks. but also the status and motivation of SPC, which is key to all of our countries. We want to promote health at a community level. We want to make it alive and real. So we want to promote and help those healthcare workers, and we have not yet found the solution. There's also the question about in Niger about digital health, which is an innovation that we can promote maybe in other countries. Ladies and gentlemen, it was a great pleasure to be part of this panel in this webinar. Unfortunately, there's never enough time to really delve into the question and answers, but many questions are open and we will continue to answer them in other platforms. To conclude, a pregnant woman in Africa is a woman which has a foot already in the tombstone and a foot in the land of living. This is what we say. My question is, until when are we going to continue to give meaning to this motto? Or what must we, or what should we do? What should we do more individually or collectively to make sure that a pregnancy is a happy experience for a woman? Thank you to all of you. I will now give the floor to Mrs. Ouattara, who's head of financial health at the community level at Femeni Health, for her final closing remarks. Thank you so much. Thank you so much, Dr. Ginette. I'm head of department in terms of financing for Mali Health. Thank you so much to all of you. Everybody who joined us for this important discussion that covered maternal health and maternal death. The presentations and the dialogues were very instructive, very important. And we're committed to helping mothers. We have benefited from your experiences and your approaches. In spite of the challenges that we face, our panelists showcased greatly all the efforts that are being deployed to eliminate maternal health, maternal death, maternal mortality, and all the different approaches deployed by Pathfinder to improve health. Especially focusing on the delays and the for too many. We also noted the strategic efforts deployed by the different health ministries of the countries that we have covered, in spite of a very challenging safety areas context. From an organization point of view, at a community level, we need to work directly with maternal health workers. The solutions that we are seeking probably rely on digital health, but also on our own approaches. We need to evolve. We need to be delegating work to the community. In another decentralized context,
être dirigé par la communauté signifie placer le pouvoir entre les mains des personnes les plus touchées par
being community-led is to give power to people in the community, to the people on site. That means women of our community. So that means working with women to understand their needs and guarantee that they have their voice, they have their own voice. It's not easy. It requires a change of mentalities from healthcare workers, but also from the politicians. We cannot think on our own and imagine the needs of our constituents. We need to invest into healthcare workers and midwives. We need to dismantle the typical hierarchies and provide women a place in negotiation tables. Eliminating maternal mortality, pregnant women must be at the heart of conversation, at the heart of our approaches and our solutions. Today, donors, responsibles at the ministry level, and everybody, we all encourage you to become champions, to delegate work at the community level. Let's work together to build a system that is truly adapted to the women that need it. Thank you so much.